Everybody, welcome to week 14. Oh my gosh, can you believe how close you are to the end? I am so proud of you guys. You guys are chugging along and doing a great job. All right, week 14, action oriented. When I think of action oriented, I think of somebody who sees something and does something about it. Somebody who is not a whiner or a complainer, but willing to actually do something to make things better. Somebody who is able to prioritize and see what things are important. Someone who's able to meet deadlines. And someone who doesn't rest on their laurels and is always kind of striving to move forward. I see those things as being action oriented. I'm interested in reading what you have to think and what other attributes you think action oriented applies to. Some of you in your work settings had mentioned things like shared governance committees or hospitals going for magnet status and different things like that. I see those within the realm of action oriented. I think they're very exciting. So I'm looking forward to seeing what you have to say about that area. All right, so we're getting close to the end of the course. I just want to remind you that I think it's week 15. Your final evaluation from your practicum preceptor is going to be due. And sometimes we know that it takes a little time sometimes to get things back from our preceptors. So if you could just start putting in a few little ideas in their heads about, when it's due. That would really be great if we could get those in on time. So that would be helpful. This week, as we're getting very close to the end of our course and you're getting very close to the end of your program, I am adding a list, I guess, about possible interview questions for nurse educators. I think most of these apply to academia interviews, but some of them also apply for interviews for nurse educators in the clinical setting. I think some of them could be used for either one, depending on the organization that you're going to apply with. And so let's just talk a little bit about that process. And I think it's being action-oriented, thinking about what you want to do after graduation. In academia, I've been involved with ADN and BSN programs, small colleges and universities, and most of the time, you will spend some time with whoever's hiring, a dean, an associate dean, whatever, and usually you'll have to do a teaching demonstration. They'll usually tell you a time frame, and they may or may not give you a topic, so you'll do a teaching demo. That demo might be in front of faculty members. It might also be in front of students. And oftentimes, you'll also have a chance to be in an interview process with some of the nurse educators. That can sometimes be a little bit intimidating. But look over these questions and see how you would respond to them. And then on the clinical side, I would say more often the CNO or a nursing director, someone on that level, does some of the interviews for clinical education positions. And then depending on the facility, you might have a group interview with staff nurses, other managers, other educators, different things like that. So more and more these days, I think we are having more people involved in the interview process. Of course, if you have a very small facility that you're interviewing for, you might very well interview with one person. I have seen sometimes for clinical educator positions having to do a teaching demo. So I wouldn't be surprised if you're looking towards that sort of position. With both types of interviews, you certainly want to do some of the things that we've talked about, looking at the mission and vision of the organization. First of all, you want to make sure it's a fit for you, but you also want to be able to tie that in with your interview to be able to respond to questions about it or to bring it up during your interview so that you can show those people that you really are interested in the organization, that you're not just trying to get an initial educator position. And then finding out background about the facility, the organization, whatever, to really kind of understand as much about it if you can. If you can talk to someone who already works there, or if you already work there, so much the better. Okay, we talked a little bit when we talked about socializing to the role, about the pros and cons of being an educator in an area that you already work at, and how some people have gone to other units to take educator positions if they wanted to stay within the same organization. So something like that might be a challenge for you. This week, besides our action-oriented question, if you have any questions that you think myself or your fellow classmates can chime in on, any questions about interviewing, preparing, looking for jobs, different things like that, hey, please feel free to throw them out there. I mean, gosh, there's 16 of you and one of me, and we've got this great brain trust of information. So, throwing in any questions out there that you might have. All right, I am looking forward to reading your portfolios. They're usually a really fun assignment for me to dig into. I enjoy looking at your accomplishments and your thoughts about things, and sometimes some really creative things come out. So I'm looking forward to that. And I think that's about it for this week. So I look forward to seeing you in the main forum, and oh my gosh, it's week 14. We're almost there. All right, see you in a bit.